some best practices guidance that we are developing and will be published soon regarding day services by providers in the District of Columbia. I do want to start. I have mentioned to people that we have a committee that's been working with us on reopening day, and there are a number of folks between the advocacy community, provider community, self-advocates, and DDS staff who have been working together on this. They, as people are aware, they completed the community participation assessment and questionnaire, and then another committee, which includes some folks who are all listed as panelists this afternoon, that includes some providers, DDS staff. I hope I'm not leaving any. I don't want to start naming people, which I should do, because these folks did a tremendous amount of work. Tasha Klusman, who coordinated this for DDS, worked along with Beth from Azure. We had Charlene and Valdez from UCP, Bill from PSI. I'm sorry, I'm not Bill Howard, I believe. Tony from Art Enables. And I hope that I'm not leaving anyone out. This group really came up with a really comprehensive guide for providers to be able to use as they're developing their plans for how to reopen. And it really identifies all of the areas that they need to be considering to ensure that as they begin to provide day services, that they do so in a safe manner, consistent with the guidance provided by DC Health and the mayor. Speaking of DC Health also participated and has provided some input for this. Sorry. So I will just briefly review our data for the week, and then I'm going to turn this over to Tasha Klusman, who's going to walk through the guidance. So today we have this meeting from 12 to 1, and then from 1:30 to 3:30, we're going to have a much more detailed deep dive with our providers around this guidance to make sure that they understand all 12 areas and that they don't identify an area that we may have missed. And that's going to occur from 1:30 to 3:30. And so as Tasha walks through this, when we get any questions from community members, we will respond. We'll do our best to respond to those during this hour. If we get questions from providers, in the interest of time, we're going to defer those and answer those in the 1:30 to 3:30 session, to make sure that we have the time to respond to any community members' questions. So, so that people are aware, so this week we, as of today, there have been 227 people supported by DDA who have tested positive for coronavirus. Of those, currently 3 are hospitalized. Unfortunately, we have lost 30 people to coronavirus. 117 of these 227 people required no inpatient care for coronavirus, and 77 of them required hospital care but have since been discharged. Of the 30 who are deceased, they all also required inpatient care. The breakdown in terms of the kinds of placements that the people who have had coronavirus were in, 3 were in host homes, 84 were in ICFs, 16 in natural homes, 2 in a nursing home, 27 in reshab, in residential habilitation placements, and 95 in supported living placements. Amongst our provider staff, to date, 255 staff have tested positive, and that includes 8 people who work at more than one, who work for more than one provider. And unfortunately, amongst providers, they have lost 6 people to coronavirus. So with that, I will now turn it over to Tasha so that she can walk through all of the good work that the people have done from the reopening day committee. Tasha?
Good afternoon, everybody. You can hear me, yes?
Yes, we can. You have to get used to the idea that you hear nothing back.
Absolutely. And when you have a document up, you really don't see very much, but like you can see math. So that's reassuring. Um, thank you, Andy, for your opening. It was really comprehensive. And yes, you got all the names and the provider names right. I would like to add my Spiegelman, who has joined us to help us make sure that we get all the links in there that we need to have. And also, Andy participated quite a bit, which helped um, bring us to the point that we are today. So we have a very tight hour. And like Andy said, we definitely want to get everyone's feedback. So please, fill the chat box up and we'll do what we can to not only respond but pull it in or research it to add it as to make this as comprehensive as we can. So what we started to do wanted to do was to give the guidance, and it starts out with a preamble that really says what this is for. And I won't read it line for line, but again, it is for everybody. We're hoping that participants, families, owners and managers of providers, and our team members all will see this as kind of the step by step or the 12 points that we can all band together and all kind of go to the same resources and information on, which is why there are links within. And there is actually a lot of reading. The document itself, we try to make it very reader friendly and user friendly by bulleting, but the links are very, very important. And again, it is about best practices, good common sense solutions, and then building in those public health standards and for the full and total purpose of mitigating and preventing people contracting COVID. And so as we open up and start to re-engage to a broader extent with the community, day program and community at large, we really encourage everybody again to take the time to go through and use the bullets. Of course, with day programs, we're really saying these areas are the areas that you need to take time updating your policies, protocols, and procedures, and ensure that your staff is trained and honestly retrained and retrained on. Again, and we would encourage all the callers, all the listeners to this call to also open these links up and consider implementing these practices. And so the first area is one that we've talked a lot about, which is the personal protective equipment, the PPEs. So making sure that what are the requirements coming into a facility, a day facility, for staff, participants, and guests? Everyone, needs to be utilizing PPEs, personal protective equipment, when we're coming to these spaces. And again, how will people access the equipment? Will it be provided? Will people come with it? But really flushing that out and making sure that everybody's clear before they show up at the door, and or being able to accommodate them once they're at the door. Bullet number 3 talks about taking the PPEs off and putting them on. There is a way to do that to keep people safe. And so there are guidelines around this, and there's a video that you can look at. So again, making sure that providers know the proper processes and that their team members are exposed to it, and then how will you ensure that they're doing that on a every time they take it off and put it on. Um, how do you assess what you have as far as PPEs and how you'll get more? I'm learning medical terms. I'm sure you guys are too. And burn rate is one of those things. And burn rate means how quickly will it be used up? So again, depending on the number of people who are coming into the facility and the activities they're participating in and how often they need to be changed in accordance with those activities will determine your burn rate. And if you know this, then you'll have you'll be able to order and keep it on hand appropriately, and again be able to get what you need. And again, because the PPE is so vital at this point, we all know that we have to wear the face coverings and the mask and those kinds of things. And so you have to have it in order to be together. And so having it on hand as needed and being able to restock it is vital. Number 5, plan to secure. Again, it talks about securing the equipment. What do you need? And it talks there about contingency capacity as well as crisis capacity. So again, as much as you come up with your burn rate, you have to build in what happens if, something major occurs at your space and you use more. 6, inventory. How do you, again, keep it on hand, know where you can get it from as needed, and that the supply chain is in place. And again, we experienced this at the beginning of the pandemic, where a lot of items we couldn't get across the whole country. So now that hopefully those stockpiles are built up, are we sure that we have access, and what do we do to make sure that those things are being ordered? I think about it almost being like copier paper was for us. How do you keep enough in the building to keep the flow of operation? And so PPE is a new item that we have to keep that flow, keep an inventory in to flow, to keep the operation moving. And then training your staff. The use of PPE isn't to be taken for granted. I mean, I'm sure you guys are seeing the news where the people who wear the mask just below their nose, that doesn't count. So again, having it and not using it properly is no good. And so again, there has to be built into our guidance a way to train our team members on the proper use, and then there has to be a way to make sure that's occurring. Number 7 talks about the written competencies. Again, what are the things that they would need to know, that they would have to demonstrate in some type of way? Again, we want to make sure that we're following the guidelines that are coming from DC Health and the CDC guidelines. And so we have a link there for that purpose, to lead you and to guide you, and to offer support and training in. 8, at the end of the day, again, as I said, it has to be something that it is required, and therefore it's going to have to be enforced. And what does that look like? What is the appropriate kind to be used at what time? And again, what does it mean if you don't have that? And then you see there's face coverings versus the person being served. What happens if there's somebody that we support, honestly, who we know can't use the face mask? What does that look like? And also, what occurs during meal times, and with social distancing and staff in place? How do we manage all of this? Again, this is a guideline to help you think about and figure that out. And some of it is, for the whole facility. And then, of course, we know it's going to have to be personalized and person-centered. B, protocols for safe disposal of and use of PPE. So again, like the doffing and donning, when you take off the PPE, we need to know what's required as far as making a safe disposal of it, not just throwing it into a trash can that anybody has access to or that's open, but the way that it's properly to be disposed of. And again, that may depend on what's going on in your facility, but you need to think about that and know that, and incorporate that into your processes. And 2 gets into the step-by-step to open a biohazardous trash and receptacles and those kind of things. And again, for most of our day programs, we had not thought about these things heretofore. And so we want to put it in to make sure that it's something that people are paying attention to and that it is built into your new processes. I'm moving to 2, and I can't tell because I can't see a chat box or anything. Can I guess Kirk, someone will stop me if there's a question or something we want to respond to.
There are no questions so far, but your chat box, if you click on that little bubble at the bottom of your screen, you're sharing a document. You can't see it. I will let you know if there are any if there are any questions. Thank you.
Perfect. Thank you. So number 2, intensive universal precautions. Again, while this is using signage throughout the facility, we have asked that this will happen in our residential locations, and it must also happen at our day locations, that signs be posted. And the first of which is how to hand wash and use hand sanitizer. And again, this is something that must occur. There must be regular hand washing and use of hand sanitizer. So making sure that the instructions to do that are throughout the building, making sure that soap and hand sanitizer is available, and also honestly making sure that it's built into the day how often it'll should hand washing versus hand sanitizing occur. So between activities, which activities will you sanitize your hands before you start? And again, as an example, if there's some activity that requires people to touch pieces together, then again, hand sanitizing will be very important before you start the activity. And then as you transition, there may be another opportunity. So building that into the day. Number 2 talks about touchless sanitizer. So again, is there a way that, or not is there a way, how do we ensure that there's touchless hand sanitizer available in multiple locations throughout facilities to make it very easy for everybody, again, staff, participants, and guests as needed to do that. And then keeping the signs and the directions, as we've all become accustomed to, on the floor and on the walls, telling us how to get to what we need, how to hygiene and social distance. So again, if you're going into a space, is there that 6 feet on the floor kind of marker? So again, the link will help providers figure out what works for their location as far as the size and the space, and what kind of signage and posters and those kind of things that are available and that they can use. B, enforce social distancing. For facilities, this is going to be huge. When you look at your space, you have to think about it totally differently. So one of the things we thought as to help with that and to keep the number of people reasonable for space and allow for proper social distancing is actually staggered schedules. So again, there is nothing that says a program or that activities have to run between 10 and 3. There are people who may be early birds who would like to come earlier. There may be some people who want to sleep in and could come a little later. There even could be eating hours, just depending on what you could work out as far as your program and the type of activity, and honestly, what people want to do, the participants want to do. So how do you think about that differently? How do you reimagine what your day could look like, and the number to help support a decreased number of people in the building? 2, the staggered entry would also help when it comes to keeping people 6 feet apart. How do you have them check into the program? The staff have to escort. What needs to happen when people are coming in? So even if you have scheduled just 5 or 8 people coming in, what does it look like so that they're not all showing up at the front at the same time? And how do they get to where they need to be given this new format? 3, it says providers should consider markings on the wall and the floor, and we're strongly encouraging this. Again, I think for anybody who's having the opportunity to get out to any type of store, you now go in and you look for the arrows to tell you this is the way in, this is the way around. Go down this aisle, go up this aisle. So this website will help you with that. How to make it look how to make it clear for people, how to make it very plain and easy to follow. And that's important. Again, and this is to encourage and support social distancing. Number 4, in rooms and classrooms, clearly people have to, be 6 feet apart. So what does that look like? And what's the maximum number? And we're going to be working with DC Health, or we're going to be following the DC Health guidelines on this for square footage. Again, what's the amount of space in terms of people who are able to come into the building or be in the building at one time? Number 3, again, I'm assuming there's no questions, daily mandatory COVID-19 screening protocols for staff and participants. Again, by now, most of you have experienced your temperature being taken. This will have to, of course, continue into the day program. And so we need the day program teams and staff to be trained and fully aware of the process coming through the door. We need participants and everybody to be mindful that, again, it will occur, that your temperature will be taken. And what does that mean? Is there a way for you to know before you leave the house if you have a temperature? We've talked a lot about this one, how important it is that if you're not feeling well, but if you have a temperature, any of the other indicators, that you don't you don't even get on the van, you don't even leave the house that day, because when you get to the day program, your temperature will be taken, you'll be asked the questions, and you'll have to go home, you'll have to go back. And what does that mean? What does that look like? We want everybody to be able to have the touchless temperature check, or we're recommending that. And again, it says in parentheses, preferably outside the facility before entering. It's so how does the program set up a space where people's temperature can be taken? And again, as I just said, if somebody's temperature is elevated or they're showing other signs and symptoms, that they don't go in the building, but they don't sit outside in the elements either. What's that in between space that we now need to allow for a screening process and for your temperature will be checked again before you leave the building. And again, the purpose for that, or leave the program, the purpose for that is not to expose anybody on your way home. And so again, we'll have to work together to, not spread, the virus. And so again, how do we put in enough steps to make that work for everybody? B, COVID screening questionnaire. Again, first is your temperature taken, and then there's the questions that we've all heard. Have you been exposed to anybody recently? Are you having any symptoms? Have you been out of the country? And at this point, have you been out of the state? Or you gone to certain states? And again, this really talks about residential providers and family members needing day programs will absolutely need that cooperation and collaboration, because we will need to know, or have a way to know from home, that these questions were asked prior to the person coming. And we've had quite a few conversations about what that should look like. So for each day program, really them working it through. We know we have some family members who don't use technology. There may be some who get a individual phone call, or who know to call in the morning. Some providers may choose to use a note system or something like that. So, and then there's some technological options that we have. And again, we want each provider to explore those. There's some larger discussion about maybe a group way of doing it. But again, really wanted to put it on the list and get people thinking about it. 2, if you arrive at the day program without some way of people knowing what your status is coming from home, what does that look like? And again, we have talked about, again, calling to check in with people, but we want to, again, particularly on this stakeholder call, really ask for everybody's support and cooperation when it comes to this. Again, we all should be getting up, getting ourselves together in the morning, but then kind of going through that checklist in our head before we start to move around and leave the house. So again, if you have a temperature, or if you can answer yes to any of the questions, then you really should be choosing to self-quarantine. C, maintaining confidentiality and dignity. With the screening, with this whole process, we want to make sure that people's it's done in a way that allows for confidentiality and, of course, dignity. So it shouldn't just be out in the open, and how do you keep the information confidential, even for people who, whose temperatures may be elevated, who answer yes to the questions? It's a really important thing for providers to consider in their process, and then to make sure, again, that staff is trained on, and that it's carried out, again, in a way that allows for the confidentiality and the dignity of everyone involved. 4, bi-monthly COVID testing for staff, managers, and participants. Again, this is something that is being discussed by DC Health, and honestly, it was a sticking point for this committee. How often do people need to be tested in order to maintain safety at the day program? So first, and before resuming, or as we reopen, we would want and think it a strong recommendation that everybody be tested, that staff be tested, that participants be tested before coming back. And then after that, how regularly should there be a reoccurring testing to keep everybody safe? And of course, B says all staff and participants must be free of communicable diseases prior to returning. And C says all staff and participants must test negative with a written verification of that in order to come to the program. So again, these are recommendations, and it's really important, again, that we work together on this to keep everybody safe. D, testing should be administered through a district COVID testing site, and we've had a link there so that people will know where they are and have access to them. And again, E says if participants or staff report the onset of COVID symptoms, verified retesting is required for known exposure. So again, if for some reason you can answer yes to some of the questionnaire kinds of questions, experiencing symptoms, come in contact with somebody, you then would have to definitely have a retest and verify. And that's outside of what would be a regular reoccurring kind of a testing.
Tasha, can I just reinforce the one issue you raised there regarding testing, which is that, as I've said, DC Health is working on guidance for all adult day programs. And so DC Health, in that guidance, I believe, addresses issues related to testing and requirements related to testing. And so we may need to tweak the language to be clear that this is a best practice guide and not a requirement in terms of DDS requiring particular frequency of testing in this document. But we are saying that this is a guide for providers to be able to establish what their requirements will be, and that DC Health will be issuing guidance that will give direction on that and that will set a floor in terms of requirements for testing.
Also, there are a couple of questions that came in to just clarify. Do you mean bi-monthly or twice monthly staff testing? I know the director just gave a little bit more on the testing, but just wanted to clarity to what you just said.
It was twice a month, so every 14 days, basically, or
right. And of course, as the director just said, there's further guidance coming down the line that will specify more details.
Absolutely. You had another question?
Nope, that's it. Please continue.
Yeah, very good. 5, required facility sanitation and cleaning protocols. Develop and document the cleaning schedule for each facility to know that, well, there's an intensified amount of cleaning and sanitation that must go on, not just at the beginning or the end of the day, but throughout. And what does that look like? So B talks about the frequency, and again, based on CDC and DC Health guidelines. And it goes into all the type of places that need to be cleaned, the surfaces need to be cleaned, and it even gets into the type of cleaner and disinfectant and solutions that you should use, which is what C is, and that link is. So again, cleaning will look different than it did prior to COVID, and each provider would need to really think that out and lay that out, and again, make sure that everybody knows how it should be done, when it should be done, who's going to do it, what they should use, and how often. 6, workplace safety controls for shared and common space. Again, this is a very interesting area, and I encourage people to really take a look at the guidances on it. But shared space, and the first one is restrooms, and we have a whole section about bathrooms, but so I think of kitchen space and break spaces, and it says printer areas and file rooms and cabinets, coat closets, places where a lot of people go, whether they're there individually or, a couple of people at a time. Many people are trying to minimize those shared spaces, just kind of eliminate them. So for instance, lunchrooms aren't necessarily the thing right now, because again, if it's someplace that a lot of people come into, there's just a better chance of stuff being left and then other people coming and touching and taking it out. It ends up being a hot spot, so to speak. So really thinking out your spaces to make sure that you're limiting those common spaces. And then, of course, for those that you can't eliminate, minimizing the number of people that are in them and, who utilize the space at all, and or and for sure increasing cleaning and sanitation of those areas. So again, really paying attention to the space and how to set up a flow and a usage that doesn't create opportunities for the spread of COVID. 7, COVID mealtime protocols. Again, back to PPEs is what E says. So, of course, when folks are eating, their faces aren't going to be covered. And what does that look like, particularly for people who need support when they're eating? How does staff have what they need, and how does everybody stay safe during those times? Um, uh, B again talks about, or in addition to the staff, what will participants wear? You know, do they need disposable items of PPEs? And again, really going to lean on DC Health guidelines to help with you guys really put something together that makes sense. And again, it should be person centered. People's needs will drive what it looks like, but for people who need, again, assistance, and somebody's going to have to be close to them, closer than 6 feet for sure to assist them to eat. What does the protective equipment look like at that point? And for those who don't need assistance, how do you have enough space to keep everybody 6 feet apart while they're eating? 8, COVID bathroom safety protocols. And this one was geared more towards, again, when supports are needed. And A starts out with the DC Health guidance. And again, cleaning and the frequency and how to, enforce this usage by staff. So when people are going into the bathroom, how is staff enforcing, things are happening properly in the bathroom? DC Health, CDC guidance or PPE use when you're in a public facility, when you're supporting somebody in the restroom. C says consider dedicating facilities, restrooms, uh, to participants where you know that there's no one but participants going in, so there's not the chance of any outside people bringing COVID in. So many of the people we support, have not been going out, and so they're much less likely to be COVID positive, or that's what we found. And so separating the restroom for visitors, staff, and participants might be helpful, and surely cleaning of all of them is regularly is going to be a key factor. D says restrict the number of people allowed in the restroom at any one period, and that's a DC Health recommendation. And again, that's based on square footage. And again, I'm going to keep saying clean up. Clean up is almost going to be a after every use, if possible, kind of dynamic. And then restrict participants loading in the restrooms with staff providing support. So how you now trained staff, how day staff is trained to be in the bathroom. Is it one person at a time, if at all possible, and you finish and they come out, and then the next person, the staff, go in? So what does that look like? But just knowing that you can't go back to what it was before, it really should be different. And considering how to make it safe given our new circumstances. 9, COVID-19 emergency response plan. Um, Again, this is guidance to help you develop your plans and policies. In this case, the emergency response plan and protocol. So your training, communication, and reporting of newly discovered suspected COVID cases. What happens if and when you actually have somebody who's been exposed or somebody who has been coming to the program test positive? You have to think that process through. Uh, of course, you would B says follow the DC Health guidance on self-quarantining, and there's a link what to do if you're sick. So you're going to rely heavily and go back to we all have to continue to go back to DC Health and the CDC to lay out what we do. But then how do you as a day provider report the exposure? If it's a staff member, if it's a participant, how do you making sure the DC Health is contacted and allowing for contact tracing and all that to occur, but also how are you alerting the people who've been in contact within your location? What is the appropriate way to do that? And before staff member or participants can return to the program, requiring the verified COVID testing documentation and proof of self-quarantining, again, per DC Health requirements. But really taking the time, this section is really about taking the time to think out what it looks like for your program, your agency. D, actually confirming the exposure. So if a staff member participants report being exposed to COVID, of course they won't be allowed to re-enter the building, until they can prove that they are not positive, or that the period of time has lapsed for them to potentially become positive. Once tested, self-quarantine is incomplete. You need to verify results, and those results need to be presented to the day program. So it's not a matter of taking someone's word. So you need to think about, what does that look like? What does the documentation look like? What's going to suffice? And then again, how is that going to be maintained, in terms of, again, confidentiality and records. And then E, positive COVID tests. So develop a day program policy and protocol for reported COVID infections for staff members and participants. There has to be some contact tracing going on, and then investigate exposure to staff and participants. And what's the plan as far as notifying everybody, families, decision makers, staff, etc. And will the dynamic, whatever has occurred, result in a suspension of on-site services? What does that look like? And then what does it look like? How long will it be before they resume possibly? And what kind of test results or paperwork or documentation is going to be required? And the facility may need to be professionally sanitized. Having a plan, a policy, a protocol, and a procedure that ensures you've thought that out is key. COVID-infected staff and participants should follow the treatment protocols of their physician. And there's a guidance or a link that should help with that, or support what they get from the healthcare professionals. And staff and participants should, of course, notify DDS and DC Health when they test positive. Number 10. COVID community outings and safe engagement practices. This was particularly for our day programs who have set up community partners and relationships. And so for those entities who have who might be in somebody else's space, who may be sharing a space with another community entity, and again, we figured that you would only have control over your space, not of who the community people who are already in there. So you need to have a separate entrance and exit for DDA participants versus the public. And again, you need to think that out in terms of whether or not the space is viable anymore given the circumstances. 2 says, you're going to have separate protocols and practices for checking temperatures, the public and DDA participants. Matthew has disappeared for me. Do I need to do something different?
If you just want to hold on 1 second, Tasha, I think he's having some technical difficulties. Yeah, so just give him a moment. In the meantime, Tasha, I'll just tell you a question that came up so you can just ponder it until we can continue. The question was, how do we get the electronic disclosure form? So when Matthew rejoins, if you could just answer that, please.
Okay.
Okay, I think he's back online.
Very good. Matthew.
And I think he's back offline.
I see.
I see him now. Yep.
Okay. So the electronic.
You still don't have him.
Yeah, it's frozen again. Hi, Grace. I see that you're online. Are you able to join in? Can you just let me know to help Matthew out while his computer has technical difficulties? So I don't think Grace is quite connected yet. I'm sorry, everyone. Just give me a moment while we get our ASL interpreter back online. Okay, I'm going to transfer over to Grace Rupani. Grace, I'm going to unmute you right now. Hi, Grace, you're unmuted.
Okay, can you hear me now?
I can hear you, yep.
Okay, great. I can't turn on my camera, so you're going to have to make me a panelist.
Yes, I'll do that.
Get my back.
Okay, there you go. I'm going to mute the screen for everyone.
I guess I should be ready for this anytime.
You're still unmuted.
1 second.
Hi, Tasha. So you can continue. Grace will continue the ASL interpretation. Thank you.
Thanks. And I, with the electronic verification, I think that's questions likely coming from a provider. I think we'll spend more time with it 1:30 to 3:30, but generally speaking, I think that's something we're looking to explore more, and every provider, will initially have to take a look at it. We're not sure if that's a texting kind of a thing that you set up with your families or residential providers. That's part of what has to be explored, and we'll from a provider perspective, we'll be talking about that more from 1:30 to 3:30. And I'm gonna move on to 10, especially given I think we've only got like.
If I could just jump in. Yeah, so I'll just ask that all providers do keep their questions that are provider specific to that 1:30 to 3 o'clock meeting, just so that we can focus a lot more on what our community stakeholders and partners would like to hear. But yeah, providers are going to have that call at 1:30 for more of your questions. Thank you.
Number 10, COVID community outings and self-engagement practices. And so, as I was saying, this is geared towards providers who are providing supports within other entities, facilities. And so, when it comes, and I'm on 3, to protect the health and security of DDA participants, shared spaces, conference room, break rooms, and kitchen areas and restrooms, again, should all be marked and monitored and hopefully separated. But I also want to reiterate what we said previously about shared spaces. As much as possible, you want to not deal in shared spaces, or totally limit who's sharing them. So the same 4 people should have them for that set period of time, and then they should be totally cleaned, kind of a thing. So hopefully you won't have to share many spaces, and that's really what we want you to think about with this. Again, is the space appropriate now with COVID, and or how can you make it appropriate and safe given that we're dealing with COVID? And again, that's really what 4 says. Each organization should have areas that are their own and not shared. And so as you plan out and look at the space to make that decision, B, restricted restroom access to participants and staff only, no public use. Develop bathroom safety plans while in the community. This was a huge talking point for us. And I'm not going to say we solved it. We just know that it's a big one and that every provider needs to really explore and talk about it. And again, I'm sure we're going to spend quite a bit of time at the 1:30 call about that. And to that point, D, the pre-map work, and which includes restrooms and in the community. So for those programs who go back or continue or community activities, making sure now staff has what they need as far as not just any PPEs, but disinfectant bacterial wipes and sprays and that kind of thing to, wipe down bathrooms or what have you when you're out and about, surfaces that you may need to use, a countertop or what have you, a table. Staff, again, having the PPEs and participants having PPEs and just the extra supplies, disposable toilet seat covers, just, what are you going to put in place? What are you going to make sure that people have in a backpack or a fanny pack or what have you? Again, it says number 3, public sinks, faucets, and everything should be wiped down. So knowing that, making sure you have what you need to do it, and then that you are actually doing it is key. Staff should carry paper towels, toilet paper with them in case it's not available for restrooms while in the community. That was number 4. So again, preparation, 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 which again is what this guide is about. It is for you to utilize these areas to plan out. 11, update COVID transportation protocols, another just huge area. And, really teams are going to have to work with the families and providers to identify what is the best and safest way for people to access or get where they need to go with transportation. We all are hearing what's happening with the metro train and the buses. So what would work about that public transportation for some people and what wouldn't? Are we talking Uber cabs or MTM? So we're going to be looking to get guidance from, or there's links here to Metro and to MTM, and we're going to continue that conversation. So, but it is imperative that providers and teams make this a real area that they delve into deeply for each person. And again, what's the minimum safety standard? And there's some DC Health guidelines on public transportation that you can access. And for people who are refusing to use masks, what should transportation look like for them? And they may not be eligible at this time, but really just, and B says the working of collaboratively with residential providers to understand also the use that the providers have and the safety precautions therein. So for any provider who has their own vehicles, they of course will need to come up with their safety protocols, the cleaning protocols, the social distancing expectations, mask, and all of that. And every team should be asking those questions. What can we expect if we're in the van or if somebody's picking us up? What does that look like? So we're asking providers to really dig down and think about it and have that information available when teams ask, like, what is your plan and your process? Again, if you're a provider sitting down to a team meeting, you want to make sure that you're knowledgeable about what's happening on public transportation and Metro so you can inform folk and be able to let them know what their options are. 12, staff, participant training, and competencies. So we've gone over a lot. And the bottom line is that for each of these, there has to be a training and a protocol created, and staff has to show that they're competent. Unlike anything else we've ever dealt with, it is just imperative that we're getting it right. So for people to understand their plans, the COVID safety requirements is key. The COVID training is going to be ongoing. We learn something new, it seems, every week. And so these policies, protocols, and competencies will have to be updated. You have to, stay tapped in and tuned into DC Health and the CDC guidelines. That's going to be ongoing. And providers, again, should be checking DC Health and CDC guidelines. We say daily for updates regarding PPE and other recommendations and updates to revised plans. And so, um, somebody at every agency will have to make it's their job to keep their organization current. And that, again, is at the speed of light, it seems, for us as never before. We've gone through all 12. It's 12:55. I don't know. Again, is Andy coming in?
I can. I was just going to say, Tasha, you did an amazing job covering a whole lot of information. And I think as you walk through all of that, it is clear just how much work this subcommittee did. So I just want to thank them all once again. And I also want to let people know, because I've heard from both some providers as well as some family members expressing concerns about sort of, when can day open again? And my response is for one, people are aware that before day services are reinstituted for anyone, the team will be completing the community participation assessment and questionnaire and having an IDT meeting to identify what the risks are, what kinds of services would be good and important to the person and important for the person to resume, and how they could resume these services in a way that mitigates or minimizes the risks that exist. With that said, we will begin having IDT meetings as soon as this guidance is finalized. And, not only did we have a whole bunch of folks helping to draft this, but also then the mayor's office will review it to make sure that it's consistent with guidance from all, from DC Health, from the CDC, with all the mayor's orders. And in addition to that, making sure that we have the DC Health guidance on adult day programs. And while I appreciate some concern about the amount of time this may be taking, I think when you see how much went into that, you can, I hope, understand the time that it would take. But also, as I look at the numbers in the district and I look at the numbers with DDA, in June, we were doing great. It's bumping up just a little bit. And so, I'm feeling very cautious about, for every person who engages in services, that we make really cautious, reasonable decisions with, or that person make cautious, reasonable decisions about what their next steps are. And we'll be talking this afternoon with providers about some opportunities as well to begin engaging for those that do employment readiness, and for people who are still eligible for employment readiness, to perhaps work out a way that that could be done virtually, where we could fund it with VR dollars, so that we could be providing a residential service and a day service at the same time. And for the teams, when they meet, to be looking at how that team, what kinds of things work for that person. I've said many times, it is still early in this pandemic, unfortunately. And while all of us are tired from, the last few months of this, it is still early, and it is a marathon. And we all need to continue to be vigilant to ensure everyone's health and safety, our own, as well as the people around us. And so, we need to keep that in mind as we move forward. With that said, this guidance will act as a template. And what we expect is that day providers each will create their own guidance. I think that we have 2 who have done so. And so our teams will review their guidance and give them feedback. And this will act as a template to make sure that you've addressed all of the areas. And so you'll then get feedback about whether there are some gaps in your individual policies and protocols for your program. And then that guidance would also be provided to any IDT that's considering your day program, so that they can then look at what's the program going to look like and to what extent is it appropriate for this person, so that that person can consider, is it going to meet my needs in the same way that the services met my needs before? So that's sort of where we are right now as we move forward. And as Tasha said, we're going to have a much more detailed discussion from 1:30 to, I think it's 3:30 this afternoon, with providers, so that we can really walk through each of these and make sure there's an understanding, and make sure, to the extent they've identified any gaps, that we add those and get this finalized so that we can be moving forward, but in a very cautious, deliberate fashion, ensuring health and safety of the folks that we support. And I don't know if anyone from the committee or Tasha has anything to add, but like I say, I want to thank them so much for all the work they did. I see it's after 1 o'clock, If people have additional questions, put your questions in by Wednesday and we will be answering them next Friday. For providers, you can put them in and we'll answer them at 1:30. If there is nothing else and I don't see anything in the chat box, then we will end this conversation for this week. I want to thank folks and we will talk again in a week.
Director Reese, there's just one question that came in. I just wanted to say, can you please show the first page again? So Tasha, can you scroll up to the first page?
And I thought that we shared this with the invitation, did we not?
We did. It was included in the invitation.
Okay.
Somebody also asked, what does IDT stand for?
I'm very sorry, interdisciplinary team. I do my best not to do that.
So they also just sent a question that says, just want to make sure this will be published on the DDS website.
Once it is final, it will be published on our website. But everyone has seen this draft, and if you have input before we forward it to get final approval, please send that to me. And let me just say, given our time frame, send that to me by noon on Monday. Sorry.
That's all the questions, Director.
Great. So we will talk again next week. Thank you very much, everyone.